When you can deliver the high level, most important pieces of information, it's way more effective, I think. And that's what I have seen. And writing and putting together press releases, for example, where you have to put all of the most important things at the very top, right? I'm effectively doing the same exact thing when I'm talking to my families. In my mind, I'm pulling out the most important pieces of information and I'm putting them right at the top. Similarly to how the media headlines, right? The news isn't buried in the story. It's the first thing that you read.
So on today's podcast, we're joined by Dr. Sherilyn Davis. She's a board-certified pediatrician, media powerhouse, and a former health comms executive who led strategy at places like Life Science and Finn Partners. But she's also been featured in media outlets like Good Housekeeping, The Washington Post, Romper, and even Fox News. She's really shaping the way that medicine meets media. And if there's anyone who knows how to connect with a headline and a house call, it's her. So welcome, Dr. Davis.
Thank you so much for having me.
So I'm really excited to dive into this conversation with you because you have a very unique background in it. You didn't really take the traditional approach to medicine. So I kind of just want to start with your story and, how you went from medicine into media and then back into medicine, if you wouldn't mind sharing.
Yeah, absolutely. I certainly did follow a non-traditional path, and I love that. I think a lot of doctors find ways to leverage their backgrounds in medicine, but they don't often talk about it. It's becoming more out in the open now, but in the past, it was something that was almost looked down upon, right? If you weren't always practicing medicine, if you weren't spending your time 100% doing what you paid a lot of money to do and spent a lot of time learning to do, then it was frowned upon in a way. But I really am so grateful for stepping outside of that traditional trajectory. So I trained at Children's National in general pediatrics, and I actually always thought that academia was where I was headed, and I couldn't have been more wrong. And toward the end of my residency, I started realizing that I wanted to do more creative things. And that led to launching my own blog and becoming very active on social media. And this was back before social media was very popular, if you can even believe that I'm saying that. And TikTok wasn't even a thing, but more and more doctors were showing up on Instagram. And so that's where I really started engaging, and I was very thoughtful about the content that I was producing. And I found that I really liked it. And in parallel with that, I was writing. I was doing a lot of writing. And I found opportunities with a lot of these online platforms like Doximity, for example, Kevin MD, and I was putting together articles that were not only educational, sometimes controversial. And I really enjoyed that. And it actually ended up pulling in a lot of people unexpectedly who enjoyed reading the things that I wrote about. So I think that fueled my passion. And that's where I started to remember, I really love writing and I really love medical education, and not necessarily in the format where I'm in the hospital and I'm teaching, but more in that online content, digital consumable world where I'm putting out evidence-based information that's easy to understand for patients, and in my case, parents who are looking for it, because it's really saturated. The digital world is really saturated and it's hard to find that type of thing. So that's kind of what led me toward communications, health communications specifically. And so I dove in while I was practicing telemedicine. So I was doing both. So I left full-time clinical medicine for a brief period. And that's where I spent time at Lifeside Communications, like you mentioned, and Finn Partners. And one's boutique, one is a global agency. So different scale, but a lot of similar things. We're essentially working with biotechnology, biopharmaceutical companies at all stages, sometimes emerging, sometimes commercial, launching products and selling those products. And you're helping them with all of their media relations, digital relations, and then their press releases, websites, things like that. So I absolutely love doing all of that. It expanded on my academic research, which was in patient-physician communication already. And it taught me so many more valuable skills, right? About the lexicon and the words that you use when you're talking to patients or parents. And so it was incredibly valuable to me. It was right at the peak of COVID, too. So it made a lot of sense because the opportunities for practicing medicine during COVID were tougher to come by, and a lot of it was overflow into places like the ICU. And so I kept up my clinical acumen through the telemedicine for that entire period, part-time. And then I slowly started to miss my patients. And I thought, okay, maybe I'm going to explore what's still out there in the clinical world. And I have to admit, I was thinking, there's no way I'm going to find anything, right? I haven't been in the world of medicine full time in a little over 5 years. And I'm not certain that anyone's going to be interested in me jumping back on board. And I couldn't have been more wrong. And I'm so fortunate for that. And I was really lucky. I knew that I didn't want the hospital setting. So that part had already been tucked away. I already learned that about myself. And I was exploring private practices, and I came upon an opportunity that I would describe as a once in a lifetime opportunity. And I leapt at it. And it is where I'm working now at Elliston Pediatrics. And it's a concierge care model. So it is totally different than the traditional setting, which I didn't particularly like. When I was in the traditional setting, I was seeing upward of 35, 40 patients a day sometimes. And I didn't have time to do anything. I mean, I barely had time to talk to the families, let alone examine the children. And then they were on their way and nothing was really addressed. And I felt like I was providing some of the worst care possible. And it's unfortunate because that's just how medicine and healthcare is set up, at least here in the States. But this model is so different. So I do all of the care, all of the physicians in the practice, we do all of the care in the homes of our patients. And so we cover Manhattan, and we have one provider who covers Brooklyn, and we bring everything that we need with us to the patient. And we have more time to spend with them, up to an hour or more if needed, which is so much different than, the 5 minutes or less that I had previously. And it allows us and me to create these really long-lasting, meaningful relationships with the families. And that's what I always envisioned when I went to medical school. I had the same pediatrician the whole time that I grew up, Dr. Engel, right? He knew the entire family. He took care of me and my sister. He knew my mom very well. And that didn't exist until I found this. And I've been with the practice for over a year already because time absolutely flies. And I haven't looked back. And along the way, I've continued, as you mentioned, to contribute to the media because I really enjoy it. And I think that we need more media experts. We need more physicians getting out there, spreading evidence-based knowledge that's rooted in the science and the data. And I enjoy it. I've been authoring for GoodRx for, I think, again, close to 5 years, maybe. Potentially a little less. Don't quote me on that. But I love my editor. I love putting together that content. It allows me to stay up to date on so many things, even outside of the world of pediatrics. And so I would say that for anyone looking to pivot from clinical to non-clinical or do both, it's 100% possible. And it's really fulfilling, at least for me.
This is why I love having these conversations, because every time I dive into someone's story, I learn something about them where I'm like, it's funny, I already had a list of questions I want to ask you, but I'm going to throw those out and I want to just dive right into the ones that are more applicable. So first thing I want to ask is that, do you feel that your experience in healthcare communications and even your experience writing, has that actually helped you become a better doctor in any way?
100%. It has helped me tremendously. I find that I am able to deliver information in a much easier to understand way and more succinctly, which is really important because busy parents don't have time to sit through a lecture of information. So when you're able to communicate to them very clearly the main points, and maybe they'll come back with additional questions, you can go into more detail, but when you can deliver the high level, most important pieces of information, it's way more effective, I think. And that's what I have seen. And writing and putting together press releases, for example, where you have to put all of the most important things at the very top, right? I'm effectively doing the same exact thing when I'm talking to my families. In my mind, I'm pulling out the most important pieces of information and I'm putting them right at the top. Similarly to how the media headlines, right? The news isn't buried in the story, it's the first thing that you read. And scientists and doctors are trained the complete opposite way. When you go to medical school, you're told, okay, what's the entire history of the patient? And it's so easy to forget that the opening thing when you're delivering on rounds or handoff is the key takeaway. I think that gets lost and buried and forgotten about so often. And this experience has really allowed me to do a 360 and totally change what was almost ingrained in me throughout the entire training, because you can get lost in the details. And a lot of times those don't really matter to the present moment, and the most relevant pieces of information should really float to the top. So I would say 1,000%, even more than 100%. Absolutely. It has helped me be a more effective communicator.
I don't know if you know this, but the actual reason that I started this podcast in Med Story is because of an experience when I was with my mom going in to see her doctor. And it was really exactly what you were explaining. Like, we went in to see the cardiologist. We had 10 to 15 minutes with her. And really quickly, she started to just start talking with medical jargon about all the tests that she was seeing and all the outcomes and then the plan of care. And like, sure, me as a healthcare provider, I could understand what she was saying, but I could see the look on my mom's face was just like glassed over. And I thought, here's this incredibly smart doctor, but if we could find a way to help her learn to find a way to communicate more succinctly so that she can actually tell us in that small period that she has, but then also maybe even start creating additional resources outside of the clinic that patients can access and hear their doctor speaking about things. Because oftentimes with these complicated subjects, we need to hear it multiple times or in different ways to truly understand what's going on, right? And so when we look at key takeaways, how can we turn a key takeaway into like an effective headline?
Yeah, it's a great question. I think that keeping it short and simple is one of the best approaches, and leaving out the jargon, just as you mentioned. People get confused by the complex medical words. You can often capture that exact meaning by using a much simpler phrase or a different word. And that makes for just as catchy as a headline, because more people will understand it than if you put together something that's maybe really attention grabbing to a smaller subset of people, like trained physicians, right? Or residents or medical students. If you want to make a larger impact, you really should write at a lower reading level, right? Grade reading level. So often when I'm writing for GoodRx, for example, I'll look to see that I'm not writing above like an 8th grade reading level. And I'll often aim for lower than that, 6th grade, because then way more people can understand what I'm saying. And by keeping it short, I think that is more attention grabbing, right? The attention spans of everyone with how much we are online, all that consumption. I mean, just imagine scrolling. I can hardly stand a video for more than 15 seconds at a time unless I'm really interested in it. So if they're opening up with something that's short and attention grabbing, then I'm more likely to continue watching or wanting to learn. So I would keep that at the forefront of my mind when I'm turning takeaways into captivating headlines. And also, what you said brought me to another thought that I think is important to point out. The communication in the traditional practice setting is so much harder, right? Because the doctors do have less time. They have less time to think. They have less time to distill the information down in their minds. And the way that I practice now with the concierge model, my patients have 24/7 direct access to me. So they can reach out to me with a phone call, a text message, video, photos through a HIPAA compliant app. And that too, I don't think I would have been ready to really meaningfully do had I not spent the time in health communications, understanding how phrase and tone and the things that you're saying, especially in the digital setting, can really change someone's perception and the delivery of those things. So I just wanted to point out that I totally can relate to what your mom experienced. And I think that it's also kind of a unfortunate of just how the medical world is set up, like I mentioned.
Right. Yeah, it's the reality of it. And we're not going to change, at least in the immediate future, we're not going to change that system. That system is built in there. But it
Yeah.
is cool to be in a time where all of these alternatives are coming out, where you can gain access through a concierge, primary care. But now doctors going online to be like, hey, let me provide this information that's quality and evidence based that they can find right away, which is cool. I wonder if you as a medical writer, how do you now stand out today with the advent of a chat GPT?
Well, my goodness, that's another great question. I don't use ChatGPT very often. I find that even if you're going in there to get some ideas, it's hard to pivot away from exactly what the output is because the output often is pretty good. And I think a lot of people go in, they ask the question, they get their information, they read it, and they say, oh, actually, not so bad. I'm just going to use it as is. When the intent was to go in and get some sparks and expand on it. So I actually, when I'm sitting down to write my content, really don't go to any of the AI tools. There's also still some concerns around the citation, the validity of the information. And it often would take me longer, I think, to fact check all of the outputs of the AI tools than it would for me to just find the information directly from credible sources. So I think that the best way to stand out is to not use the tools. I also think that it's really easy to tell when something's been generated from AI still. It's created in this format or this particular way that I think if you're someone who has done a lot of writing or has spent a lot of time looking at content online, it sticks out to you in a way that isn't authentic. And so I think it's really easy to spot. And so I would say to all of the creators and the writers and the people out there, if you are going to use it, really just use it as like a sounding board to maybe get some ideas, spark some creativity, and that's it. And then go and take that and turn it into something that's your own in your own voice and in your own style, because it'll be so much more authentic and credible to the audiences that you're trying to reach.
That makes a lot of sense. We're actually doing something pretty cool with our doctors is that I agree. It's like we should never let AI just drive what you're doing because we need your personality and your tone. And just with everything, bad data in is going to be bad data out. And these systems are pulling from a worldwide internet and it's going to be pretty general. And then you're right. When you read it, it's pretty generic. And what we've started to do is all the content that they produce, we actually train a custom GPT that's just for them specifically. So it's been trained on their brand, their tone, the research articles that they've cited. And so that actually helps streamline to say, at least let's come up with some ideas based on things that you've already said yourself rather than just the general internet. And that helps us in at least the process to move forward quicker. But never do I say, oh, you should just do whatever it comes out with, right? And so I think that sometimes the balance between the two can actually yield some pretty cool results.
Yeah, that sounds very cool.
Now, I wonder when you are writing, what is the balance between educating versus entertaining?
It really depends. It depends on the target audience, the content of the article. So I would say most often I'm putting together content that leans more educational, which maybe doesn't get as many eyes in a world where people are constantly seeking entertainment. So it's tricky, but I'd say that for what I put together, so often when I'm quoted in media articles, right, like the ones that you mentioned, or I'm putting together medical education materials, most often it's going to lean more toward that educational side. So maybe about 75% versus 25% being more entertaining. I think that the entertaining piece is important. And I would love to lean into it a little bit more because I think it reminds everyone who's following or watching or reading what you're putting together that you're a person on the other side with a personality and interests and hobbies. And I think that makes it oftentimes a lot more relatable too. So maybe something that maybe someone who's scrolling by who doesn't necessarily find the educational content engaging at first would see something that they can relate to that's more entertaining. And then they start feeling this connection, and that enables them to find the educational content perhaps a little bit more interesting, even because there's that underlying togetherness. So I'd say that for me, I'd love to add more entertainment to what I put together but for right now, given the target audiences and the types of media that I'm making online, often are long form articles or short form articles or just quotes, it certainly swings a little bit more educational.
Sure, but when you're writing, it still is entertaining because you've obviously found a way to keep the reader engaged. And because I have seen some physicians that they go and when they want to teach something, they lecture. And there's a big difference between lecturing and telling maybe a story that educates. And like, what do you think about that?
I think that's a great point. And I actually spent some time lecturing for doctors in training a while back. And it was similar but different. I would say that, and again, different audiences, right? When you're lecturing for something like a board prep program or an MCAT program, the people coming to that content are learners. They're looking to be lectured. And so that just a different audience and setting. And even still, I will admit that doctor training, when I used it, I don't think it's around anymore, but it was a thing, it actually was pretty entertaining. The other lecturers put in a lot of jokes and a lot of things to keep the learners engaged. So maybe not the best example, but different audience. When I'm writing, yes, there's an element of storytelling. There's also just tools that you can use for the reader that permit them to take pauses or take space and then come back and not get too overwhelmed by the content. So a lot of the times you'll see quotes. Quotes help break up the content. They provide some of that entertainment, I guess, like you were saying. And then bullets. Bullets are a fantastic tool. I use them all the time. Dashes are also a really great way to just create space and allow the reader to process all the information that you've put in and not get lost in it. So I almost think that like grammar, punctuation, maybe some of the things that you put in, the tone, you could have perhaps a little bit of humor, empathy, right? That's, I guess, the source of entertainment in a different way, but still entertainment nonetheless in a writing format.
Okay. Yeah, that makes sense. It does. And I think it's as I hear you say this, it's pretty interesting because when I'm reading an article, I'm not thinking about that there's purpose behind those things. But you as the
Yeah.
author, like there's purpose in all these little things. Like I'm more into like the verbal communication side and the importance of a pause after an important point to allow it to sink in. But it's the same thing for written communication as well, it sounds.
Yeah,
Um,
totally. The more we talk about it, the more that I'm realizing it in real time.
and so if say if a doctor's listening to this right now and they say, you know what, I would love to start writing or be featured in some of these publications, like where would they start?
I get asked this all the time, and I always say network. Your network is one of the most powerful tools that you have. And if you go and look at who you've connected with, who you're still connected to online or in real life, you'll probably find that you have so many people who have so much experience and they may not have even talked about it, but who are willing to help and figure out ways that you could start doing these other things. Specifically, doctors. There are a lot of doctors who I think have jumped into this non-clinical world, whether it's part-time or full-time or in addition to their clinical jobs. And the best place to find those people really is online. So LinkedIn is so powerful. Doximity is another great place. I've actually had a lot of people reach out to me there and ask, what do I do? Because I'm burnt out and I want to leave clinical medicine and I want to do something like you did, but I have no idea where to start. So they have found me and asked me about it there. So that's evidence that Doximity is a great place. LinkedIn's a great place. My route specifically, I went to a website called Doc Jobs. It actually stands for Dropout Club, for scientists and physicians who are looking to, quote, drop out of academia or medicine or whatever you want to call it. And they have a lot of job postings there that allow you to flex your background in new roles. And so that's where I actually got started. And then it was that, and in addition to my network, that led me down the specific path that I ended up taking. So networking is a huge, huge tool. Those websites like Doc Jobs, but even other job posting boards, I think, are great places to skim and look. And I would say, just put yourself out there. Don't be afraid to message a person, to cold call a person and say, hey, I'm looking to do XYZ. Am I able to? For the media placements, there's actually a website called Help a Reporter App, HARO, that a lot of journalists are familiar with, a lot of physicians are familiar with when they're looking to provide quotes. So you can serve as either a source or a person who's looking to contribute. It goes both ways. It's free to use. They put out inquiries 3 times a day for all different topics, health included, tech. So there's lots of different tools that exist. And so it's just a matter of figuring out which ones are best for you. But I would say those are where I most often looked when I was first starting to get my name out there more. And then Instagram too, when I was looking to collaborate with different brands, when I was growing, when I had an audience and companies would come directly to me, it would often just be through a DM.
Yeah.
So that works too.
That was amazing. You just gave us a master class right there on what we need to do to get started, to get in front of those people. I think one of the main takeaways, and it's interesting, I was just having a conversation with Dr. Nate Wood, who's also very active in media. And we were talking about how sometimes we assume, like you assume you're a physician, people should come to me because I have this expertise. And there will be times where that happens, but oftentimes it doesn't. And you need to be willing to do the work, to do outreach yourself, start producing your own content, just to start getting your message out there, right? And I think maybe there have some challenges to overcome the barrier and change their mindset to saying, yes, this is something that I need to do in order to start reaching or creating these kind of opportunities. Have you had any challenges with that and developing that mindset for yourself?
Yes, I think that it's intimidating to put yourself out there. And I think a lot of people who are in medicine aren't necessarily looking to be out there in the public eye. I think that COVID actually pushed a lot of doctors to come out and online more because there was so much misinformation spreading and no one knew how to really combat it other than to get online and start talking about the facts. And so I think we saw a surge there. And I would say myself included, often I think, well, maybe I shouldn't post that. Maybe there will be some criticism. I don't look the way that I want to. I said the wrong word. I took a pause at the worst place. Even in this podcast episode, I'm sure I'll re-listen and think, oh my gosh, how could I have said it that way? I could have said it so much better, right? We're our own worst critic half the time, almost all the time, I would say. So I think it's really challenging that mindset. And you hear all the time, if you're on TikTok, people saying, just post it. Just post it. Like, just put your content out there. And what is the worst thing that could happen, truly, at the end of the day? You're going to have comments. You're going to have people that don't respond to the content. That's inevitable because you just cannot please everyone. So I would remind any person who's looking to get out there and online, that it's okay to make mistakes too. I certainly made lots of them when I was first partnering with brands. And at the time, I was a resident. I was making very little money and I was just looking to monetize my online presence. I wasn't thoughtfully thinking about who am I actually partnering with? Is this a brand that I really want to have a long-term relationship with? And so you have those moments of, oh, realization that maybe it wasn't the way that you wanted it to be, but you can fix that. You can pivot from that. You can always course correct going forward. So, yeah, I would encourage those people to just get out there, to not worry so much about the potential downsides. I think there's a lot of upside. You can reach a lot of people who find what you're saying to be super valuable and educational. And to me, even if there's one person out there, one listener who hears me on today's podcast, for example, and says to themselves, wow, I'm going to go to Doc Jobs right now, or I'm going to go to Harrow and I'm going to start getting out there. I'm going to put together content and I'm just going to do it. That means so much to me, just reaching one person. And I think that's an easier way to think about it too, right? You're not reaching masses initially. You're probably reaching just a couple of people. And that's great. It's a starting point. It's a stepping stone. And then you can grow and you're learning with your audience along the way. Things are constantly changing too. The online world is rapidly evolving, even with AI, like you mentioned. So who knows what's going to come next? So I would say just go for it and see what happens.
I love that. Yeah. The worst thing you could do if you're someone that has that fire and like, yes, I want to get change. I want to get my story out there. The worst thing that you could do is not tell it.
Yeah.
And not put yourself out there. Right. And
Yeah.
it's a process, an ongoing process, but it's also a muscle. It's a muscle to try to be like, I need to be willing to put myself out there, be vulnerable and understand that people aren't always going to respond the way that I want them to respond.
Totally.
But with the practice, it gets easier and easier. And you start realizing like, I don't care as much what they think as I once did. And that's actually a really empowering thing.
100%. And there are people too out there who can help. Coaches can help. You can find media trainers if you're feeling really nervous about the first time that you're putting content out there. People like you, right, can help physicians find their voices that in a way that makes sense for them when they're entering that online digital sphere. So that too is another piece to remember. A lot of the people online probably have had some help or a team. It takes a village, right, to get their content online, especially if it's looking really polished, because that takes a lot of time and energy. And I'm sure there are some people out there doing it themselves, and I give them so much credit. And I'm sure there are other people out there who have people behind the scenes helping them. And don't be afraid to get the help is what I would say if you feel like you benefit from it.
That's amazing. I could have this conversation and dive deeper as we go, but I want to be mindful of your time as well. If someone wants to learn more about you and maybe even reach out to you, where is the best place to go?
Yes, on Instagram, my direct Instagram is the easiest way to reach me. And that would be at Dr. So Dr. Sherilyn Davis, Cherilyn Davis. And then to learn more about my practice, they also have an Instagram at Elliston Pediatrics, or you can read more online at ellistonpediatrics.com. So it's ELLISTONPEDIATRICS.com.
Oh, perfect. We will make sure we will put that in the show notes below if you do want access to that, to reach out to Dr. Sherry. This has been awesome. And for anyone that's listening, we appreciate it. We're always looking for people like you that have an amazing story and can really empower the other professionals in the community to get out there and share their stories. So thank you so much for taking the time to sit down with me.
I really enjoyed it. Thank you so much again for having me.